Hi, I'm Dr. Paul Crook. I'm an orthopedic surgeon specializing in sports medicine here at Tennessee Orthopedic Alliance, and today we're going to be talking about rotator cuff tears. So before we get into the nuts and bolts of rotator cuff tear, I just wanted to go over a few statistics and key points about why this is important. Rotator cuff tears are the most common cause of shoulder disability in the United States. And rotator cuff tear significantly increases with age. Studies have shown that only about 5 or 6% of people below the age of 60 have rotator cuff tears, but upwards of 30% of people above the age of 60 have rotator cuff tears. Also, rotator cuff tears can get worse if they're not addressed. Recent studies have also shown that about half of rotator cuff tears actually worsen and get larger over time, and therefore they get harder to fix. So first off, what is the rotator cuff? We have a couple of models here to look at. So the shoulder is a ball and socket joint, okay? It moves in various directions, helps you raise the shoulder, you can externally rotate, you can internally rotate, and the rotator cuff muscles help move the shoulder in all those different directions. So we have another model here that actually shows the rotator cuff muscles. So you have 4 different muscles over the ball part of the ball and socket joint, and they help move the shoulder in various directions. They're important for raising your arm, reaching out, and reaching behind your back. So who gets rotator cuff repairs? They can happen at any age, but they typically happen in patients above the age of 50. And there are several risk factors involved. Age is the most important one, but family history, smoking, and other medical conditions such as high cholesterol can lead to rotator cuff tears. So how are rotator cuff tears diagnosed? So when you come into the office, the doctor will first get a history from you. And typically rotator cuff tears fall into 2 different categories. Acute tears are injuries such as falls and distinct events in time where you know something happened to your shoulder. And then there are chronic injuries, which are more of wear and tear phenomenons. So typically when patients have a rotator cuff tear, the most common complaints are pain in the shoulder and then going down into the middle part of the arm as well. And then the other thing is weakness in the arm. And typically patients complain of pain at nighttime, and sometimes the pain's even severe enough to wake them up from sleep. So the next thing the doctor will do is perform a physical exam. This requires looking at strength, range of motion, stability of the shoulder, as well as a variety of special tests that isolate each of the muscles of the rotator cuff. And then finally, we start with a series of x-rays to look at the ball and socket joint, make sure you don't have any other problems such as arthritis, but sometimes the x-ray will also give us a hint as to how bad the rotator cuff tear is. And if we're concerned enough, we will end up getting an MRI of the shoulder as well, and this will give us a 3-dimensional look at the tendons of the rotator cuff. And next we'll talk about treatment of rotator cuff injuries. Luckily, the vast majority of rotator cuff tears can be treated non-operatively. This typically requires oral medication similar to Aleve or Advil that you can take over the counter, physical therapy, and occasionally steroid injections. Surgery only becomes part of the discussion after failure of non-operative treatment. So typically we put patients in physical therapy for 6 weeks to 3 months, and most of them get better with the non-operative treatment. And it's only if you fail that non-operative treatment do we talk about surgery. The one caveat to that is, again, these acute rotator cuff injuries where you have a distinct event such as a fall or lifting something heavy over your head where you have acute pain and loss of shoulder function. And in that case, occasionally it does require a trip to the OR without any physical therapy beforehand. So luckily, if it does come to surgery, technology has vastly improved over the past few decades, and we now are able to do rotator cuff repairs doing what is called arthroscopic surgery. In the past, it used to require a large incision over the front of the shoulder, and now we're able to do it through small poke hole incisions in various areas throughout the shoulder, which means an easier recovery and faster return to work and normal activities. So next we're going to look at a video that shows a rotator cuff repair. Now there's various types of rotator cuff repairs, and we're going to show you one of the simpler options right here, and this can kind of give you an idea of what is actually going on when we repair the rotator cuff. So we start by creating a socket in the bone, followed by insertion of a screw that has sutures or stitches in the eyelet at the tip of the screw. This is called a suture anchor. We then use a device called a suture passer to pass the sutures through the rotator cuff tendon. This is then repeated with a second suture anchor. Next, tension is applied to these sutures to create a compression of the tendon over its insertion site, and they are inserted into another suture anchor, which is then screwed into place into another bone socket. Finally, looking from a different view, the remaining sutures are inserted into one last suture anchor and tensioned. The anchor is then screwed into one final bone socket. And lastly, we're going to go over some common questions that people have in regards to rotator cuff repair. The first question is this procedure inpatient or outpatient? And luckily, this is an outpatient procedure, which means you do get to go home the day of surgery. These can be done in hospitals or surgery centers, but typically they're done in surgery centers, which is much easier for the patient to get into and out of the building after surgery. The next question is, how much pain will I have after surgery? And luckily we work with very good anesthesiologists who are able to do what are called nerve blocks. And a nerve block is basically an anesthetic that numbs up the nerve for about 12 to 24 hours. So during that first 12 to 24 hours, you won't have any pain at all. Once that block starts to wear off, we'll have several medications ordered for you that you can take to help with the pain. Most people are free of pain by about a couple of weeks after surgery. The next question is, how long will I be out of work? And this depends on two different factors. One is the type of job that you do, and the other is the size of the tear. So for a patient who works at a desk, at a computer all day, people can usually get back to work at around 2 weeks. But for more strenuous, heavy labor positions, such as a firefighter who might have to rescue someone from a building, it can be up to 6 months after surgery. And then the other factor that's involved is the size of the rotator cuff tear. Smaller tears heal faster, and larger tears take a little bit longer to heal. And then lastly, what are the long-term outcomes of rotator cuff repair? And luckily, rotator cuff repairs do very well over the long period. There was one recent study that showed that 94% of patients had good or excellent outcomes at 10 years. So rotator cuff repairs tend to hold up over a very long period of time. Again, keep in mind that this is just for informational purposes only. If you do have any shoulder pain or weakness, you should either talk to your primary care doctor, or we're happy to see you here at Tennessee Orthopedic Alliance.